Welcome to Module 3. We are about to dive into one of the most exciting transformations happening in medicine today, how artificial intelligence, or AI, is literally changing the way we diagnose disease. Now, for all of you entering the medical field, I want to be clear. This isn't science fiction anymore. This is technology that you'll be interacting with, probably from day one of your clinical practice. So, how is this all going to work? Well, first, we're going to look at how AI is becoming a new kind of partner for doctors. Then we'll talk about its superpower, and that's recognizing patterns that we humans might actually miss. After that, we'll check out some real tools being used in hospitals right now, and we'll clarify the most critical part, the role of the physician. And finally, we'll think about what this all means for the future of medicine that you are all going to be practicing.
All right, let's start with a scene that plays out in hospitals every single day. For decades, the entire weight of a diagnosis has rested squarely on the shoulders of clinicians, on their trained eyes, their ability to interpret incredibly complex information to find the faintest signs of disease.
I want you to imagine a radiologist. Maybe it's late in a long shift, and they're scrolling through hundreds, literally hundreds of images from a single CT scan. They're hunting for a tiny, almost invisible anomaly, something that could be a tumor or a life-threatening clot. This is just an incredible cognitive feat, and it relies entirely on years and years of training and experience. But here's the challenge we're all facing today. The sheer volume of data we get from these high-resolution images, well, it's becoming overwhelming. As some of your course readings point out, we're facing an unprecedented deluge of data. And this is exactly where AI comes in, not as a replacement, but as a really powerful new partner. So you might be asking, how can a machine possibly help with such a complex human task? Well, the answer lies in AI's core strength, which, it turns out, is a perfect match for the fundamental challenge of diagnostics. At its very heart, AI is a master of pattern recognition. And what is diagnostics, really? It's all about finding patterns that signal disease. These AI algorithms, especially the ones that use what we call deep learning, can analyze massive data sets to find these patterns with incredible speed and consistency, especially when they're sifting through thousands and thousands of images. And what's really incredible is just how broad its application is. AI isn't just looking at one type of data. It can be trained to see patterns in X-rays and CT scans. It can analyze microscopic details on pathology slides. It can interpret the complex squiggles of an ECG, and it can even find subtle connections buried in electronic health records. Again, this is not a far-off what-if scenario. It's already happening in clinics and hospitals today. So let's look at how this idea translates into real-world tools that are out there saving lives right now. It's pretty easy to see why certain specialties are such a natural fit, right? Fields like radiology, pathology, cardiology, and dermatology, they're all built on interpreting huge amounts of visual or signal-based data. As your readings point out, this just makes them prime areas for AI to make a difference. And we're not just talking about research projects. Here are just a few examples of FDA-cleared tools that you might actually encounter in your practice. You've got things like DermaSensor, which helps evaluate skin lesions. You've probably heard of the Apple Watch ECG for detecting atrial fibrillation. There's Page Prostate, which flags suspicious areas for pathologists, and Viz.ai, which triages CT scans to get potential stroke patients into treatment much, much faster. And what about the real-world impact? Well, check this out. A study published in PMC tracked what happened when an AI tool was used to help detect pulmonary embolisms, a critical finding that sometimes gets missed on CTs. Before AI, the miss rate by radiologists was almost 45%. With the AI tool flagging suspicious scans, that rate just plummeted to under 3%. Think about that for a second. And it gets even better. In that same hospital, they had a pretty big backlog of scans to read. The AI-based system cut the median time to diagnosis for these critical findings from over 5 days all the way down to just 87 minutes. I mean, that is a dramatic improvement in both workflow and patient safety. You're getting life or death information to clinicians exponentially faster. Okay, so this brings us to what is probably the single most important concept for you to grasp as you enter this new era of medicine. And that's the question, what is the relationship between the physician and these powerful AI tools? This right here, this is the principle that should guide your thinking. The literature is crystal clear on this. AI serves as a decision support tool. It's there to help, but the final responsibility for the diagnosis, for the patient's care, that always rests with you, the physician.
The AI is a powerful assistant, but you are the authority, period.
So the crucial takeaway here is to understand the complementary strengths. Look, AI offers incredible speed, it's consistent, it doesn't get tired, and it can detect patterns we can't see. But it lacks everything that you bring to the table. Your clinical judgment, your ability to understand a patient's full story and context, nuanced interpretation, and of course, empathy and communication. You are the one who makes that final, accountable decision. Okay, so let's wrap this up by looking ahead and talking about how this all fits into your future as physicians. This was really just the 10,000-foot view. In the upcoming sessions, we're going to do a much deeper dive into the specialties where AI is making the biggest waves right now. So radiology, pathology, dermatology, and cardiology. We'll explore the specific tools and really get into their clinical applications. And I want to leave you with this one thought. Understanding these tools, it's no longer optional. It's not a niche interest for the tech savvy. In the very near future, it's going to be a core competency, just as essential as knowing how to interpret a standard ECG or read a chest X-ray. So your role is going to be to understand these technologies, to critically evaluate their outputs, and to integrate them thoughtfully into your practice. And all the while, you have to remember that patient care is, and always will be, a fundamentally human endeavor, now supported by some incredible technology. That's the challenge, and that's the opportunity that's ahead of you. I hope you'll keep that in mind as we continue to explore this fascinating topic together.